How's it going, guys? Medium difficulty question, renal, step 1. 11-year-old boy, 12-hour history, dark urine, no past medical history, no medications. 3 days ago, he had a sore throat fever. Today, dry cough. No cervical lymphadenopathy, no tonsillar excites, vitals normal. What's most likely to be seen in this patient? Choice A. Dense deposits, duplication, glomerular-based membrane, wrong fucking answer. Refers to membranoproliferative glomerulonephritis, MPGN. MPGN will be the answer on USMLE if they tell you red/dark urine in a patient with hepatitis C or malignancy. This vignette is not hepatitis C or malignancy. MPGN, wrong fucking answer. Choice B, hyaline deposition in the mesangium, wrong fucking answer. Refers to Kymel-Still-Wilson nodules, diabetic glomerulosclerosis, so clearly the vignette here, not advanced diabetes, and let alone the fact that diabetes is a nephrotic, not a nephritic syndrome. You're not going to have blood in the urine with diabetes. Very important you know that, the nephritic versus the nephrotic syndromes. You should know that the Kymel-Still-Wilson nodules will appear as pink circles on light microscopy, and that the first change in the kidney with diabetes, apart from thickening of the glomerular-based membrane, that's the first physical change. The first change in the kidney is hyperfiltration. All the glucose running through the glomerular-based membrane is going to pull water with it. So you have a transient increase in GFR, hyperfiltration, prior to the decline in renal function and GFR. Choice B, wrong fucking answer. Choice C, immune complex deposition, subepithelial distribution, wrong fucking answer. Refers to PSGN, post-streptococcal glomerulonephritis, aka proliferative glomerulonephritis, as the NBME can write it. This will be red urine 1 to 3 weeks, not days. 1 to 3 weeks after a sore throat. Okay? It can be cutaneous as well. I've talked about that a lot. They can give you a kid who has impetigo, okay, cellulitis erysipelas. You can say the kid has yellow crusties on his forearms for the past 7 days, now has red urine. That's PSGN due to impetigo. Okay, so sore throat 1 week ago, 2 weeks ago, now has red urine, PSGN, easy, okay? And you can have decreased serum complement protein C3. It's a type 3 hypersensitivity. It's immune complex deposition. Now, the correct answer is choice D, mesangial proliferation and mucosal immunoglobulin deposition, IgA nephropathy. Now, some of you think this is past level. That's fine. The diagnosis is past level, yes, but the answer choices here are a bit nebulous sounding, verbose. So IgA nephropathy is going to be red urine 1 to 3 days, not weeks. 1 to 3 days after a sore throat. It's viral infection 9 out of 10 times, URTI. It can be gastroenteritis, confuse some students. They think it's hemolytic uremic syndrome. I don't want to go down that tangential discussion right now, but let's just say, for simplicity purposes, you're learning this. 11-year-old boy, sore throat, 1 to 3 days later, red urine, diagnosis IgA nephropathy, PSGN, wrong fucking answer. 11-year-old boy, sore throat, red urine, 1 to 3 weeks later, not days, PSGN, not IgA nephropathy. Easy. Okay, you got to know that for USMLE. And USMLE can write IgA as mucosal immunoglobulin. I mean, that's what it is. It's in the GI tract. It's in secretions, tears. Tangentially, for immunology questions, if the patient has IgA deficiency, the answer can be written as deficiency of mucosal immunoglobulin, OMG. So IgA nephropathy can occur on its own. As we have here, it can also be part of the Henoch-Schönlein and Purpura constellation. That's 2CK, step 3. HSP will be a classic tetrad of IgA nephropathy, red urine, palpable purpura, buttocks, thighs, classically, arthralgias, abdominal pain. Let's just hop to the final answer choices. No changes like microscopy, wrong fucking answer. Refers to minimal change disease. On electron microscopy, you'd have effacement of the podocytes. This is a nephrotic syndrome, not a nephritic syndrome. You're not going to have dark urine. So they might give you an 11-year-old boy who has infraorbital and pedal edema, maybe ascites. There was recent viral upper respiratory tract infection, and that's just minimal change disease. Treat with steroids. Wrong fucking answer. Choice F, subendothelial deposits with capillary Loop thickening, wrong fucking answer, refers to DPGN, diffuse proliferative glomerulonephritis. DPGN will be the answer on USMLE for red urine in a patient with SLE. It's that simple. So lupus nephritis, 9 times out of 10, is just DPGN. DPGN, wrong fucking answer. You know the deal. Until you make more content, really, my stuff's growing. Appreciate your time. That's it.